Hey, let me ask you something. Have you ever taken your socks off at the end of the day and noticed a deep mark around your ankle? Or maybe your shoes suddenly feel tighter and you're thinking, wait, did my feet just gain weight? If that sounds familiar, stick around. Because today on DocDecoded, we're decoding edema. That annoying swelling that shows up uninvited, usually when you least expect it. Today, we are driving into something that sounds fancy, but you should know whether your shoes feel tighter or ring knot, budging is totally harmless, or something more serious. Did you know? Let's discuss in details. Most of the water in our body, about two-thirds, is inside our cells. The rest is outside, mainly filling the spaces between cells. When too much fluid collects there, it causes swelling called edema. Think of your tissues as little sponges. When your body holds onto too much fluid, those sponges get soggy and puffed up. Edema is just the fancy medical term for swelling caused by fluid buildup in your body's tissues. This swelling can be localized, like in your feet or hands, or it can be more widespread called generalized edema. Generalized edema is caused by heart failure, kidney disease, liver failure, and conditions affecting the lymphatics, whereas localized edema is caused by inflammation, infection, venous or lymphatics obstruction, or trauma. There is constant interchange of fluid between different compartments like blood, cells, and spaces between the cells. You can consider the edema as a disbalance in this interchange because of certain condition. Why does edema happen? Edema isn't a disease itself. It's a sign, a symptom that your body is trying to tell you something. There are a bunch of reasons why your body might start hoarding fluid, like it's prepping for a drought. Let's break down some of the most common causes. Sitting or standing for too long. Gravity pulls fluid down into your legs. Long office days or travel. Classic trigger. Too much salt in your diet. Salt loves water. So more salt equals more water retention. Pregnancy. The body's fluid volume increases and the growing uterus presses on veins. Hello, swollen ankles, especially common in the third trimester. Heart problems. If your heart can't pump blood effectively, fluid backs up, especially in the legs and lungs. Have you ever looked down at your feet during pregnancy or a long flight and wondered if your ankles had been replaced with marshmallows? Tell us in the comments. Kidney or liver issues. When these organs aren't filtering or producing proteins properly, fluid leaks into surrounding tissues. Many conditions are there, like renal failure, liver cirrhosis, nephrotic syndrome, glomerulonephritis, and many more nutritional disorders. A diet grossly deficient in calories, and particularly in protein over a long period, may reduce total protein in the body, causing disease called kwashiorkor in children. Salt retention, the ingestion of more food, may increase the quantity of sodium ingested, which is then retained along with water. Refeeding edema develops or becomes intensified when famished persons are first provided with an adequate diet. Hormonal imbalance, as in low or high thyroid hormone, increased cortisol, estrogen deficiency of certain minerals and vitamins, like potassium, vitamin D, may also indirectly be associated with the condition. Certain medicines like painkillers, blood pressure, reducing medicine, exogenous hormones injections, immunotherapies, etc., etc. Don't forget to hit that subscribe button because in our upcoming videos, we'll be diving deep into each cause and its remedies, so you won't want to miss out. If any of these surprised you, or you've ever blamed puffy fingers on just a bit of extra salt, smash that subscribe button. More myth-busting health insights are coming your way every week. Different flavors of edema, not the tasty kind. Let's talk about types. You didn't think all edema was the same, did you? Peripheral edema and localized edema. This is the one most people get. Swelling in the legs, ankles, or hands, often caused due to stagnation of blood in the veins. This is common, but other certain conditions like thrombophlebitis due to clotting of blood in the vein, varicose veins, due to valve failure of the vein, etc., cause localized edema. Pulmonary edema, fluid in the lungs. Serious stuff. Causes shortness of breath and needs urgent care. Ascites, swelling of the abdomen, seen in liver diseases, cancer in different internal organs of the body, etc. Cerebral edema, swelling in the brain, may caused by trauma, stroke, or infection. Again, an emergency. Macular edema, swelling in the retina of the eyes, can affect your vision, especially in people with diabetes. Now, if your feet are so swollen that they look like overproofed bread dough, congrats, you're not a baker. You're dealing with pedal edema. How do you know if you have it? Here's how to spot it. Your legs or hands feel puffy or heavy. Your shoes don't fit, even though your weight hasn't changed. Edema may be present when the ring on a finger fits more smuggling done in the past, or when a patient complains of difficulty putting on shoes, particularly in the evening. A weight gain of several kilograms usually precede overt the manifestation of generalized edema. Edema may also be recognized by puffiness of the face, which most readily apparent in the areas of the eyes evident in kidney-related conditions. You press on a swollen area and it leaves a dent. That's pitting edema. Got a thumb? Press it gently into your ankle. If the dent stays for a few seconds, welcome you to the team edema. But wait, edema is not always visible. Blurring of vision, difficulty in breathing may also signify fluid collection in respective organs. When should you worry? Most swelling is harmless and goes away on its own. But if you have the above, or swelling is long-standing, please don't wait. Visit your doctor. Edema isn't always innocent. Have you or someone you know ever been hospitalized due to swelling? What was the cause? Let's get the conversation going in the comments. Your story might help someone else. What will the doctor do? For doctors, an important first question is whether the edema is localized or generalized. If localized, local phenomenon of that may be responsible and will be identified. For that, doctors usually start with history and physical examinations, including weight, blood pressure, type of edema, whether you're getting dent or not. And no, WebMD is not a diagnostic tool. Please go to a doctor rather than delaying it. Now let's talk solutions. Especially in the initial days, you can start doing and observe and move your body. Get up, walk, stretch every hour. Even when just wiggling your toes helps. Elevate legs. Put those feet up when you're resting. Keep a pillow below your legs while sleeping. Gravity isn't always your enemy. Cut back on salt. Avoid processed foods and salty snacks. Your heart and kidneys will thank you. Wear compression socks. They're not just for nurses and grandpas anymore. Treat the root cause. If it's heart, kidney, or liver-related or hormonal, fixing the why is the key. In initial stages, doctor may prescribe you diuretics, also known as water pills, to help you pee out excess fluid. But please don't self-medicate diuretics just because your feet are swollen. They can cause electrolyte imbalances and other issues. So here's the deal. If you're swelling up and there's no beach ball in sight, your body might be trying to tell you something. Don't ignore it. And hey, if your socks are leaving deeper impressions than your friends do in conversation, yeah, it's time to take that seriously. Remember, not every puffiness is a sign of problem. But if your feet starts resembling loaves of bread, don't just butter them, get them checked. Don't ignore it. Let me know in the comments. Have you ever experienced swelling like this? What caused it? And what worked for you? That's it for today's episode of DocDecoded. If you found this helpful, hit that like button, share it with someone who's been complaining about puffy feet, and don't forget to subscribe for more health made simple.